The slide you see on your screen is duty number 4, according to Welfare and Institution Codes 5604.2 for local California behavioral health boards and commissions. This is a presentation about community planning, and we wanted to base it in this duty, but also this will speak to the requirements of staff and the many stakeholders that should be involved throughout planning processes.
Review and approve procedures used to ensure citizen and professional involvement at all stages of the planning process. So I'm going to pause here and pull up another PowerPoint that's specifically on community planning requirements, because this is such a big topic. So this PowerPoint, which is in the materials for the training that I shared the links with you, this will describe to you philosophy, principles, and practice requirements of the Behavioral Health Services Act for the integrated plans. And keep in mind, these integrated plans are integrating with everything. So all the funding sources and all the other systems in place are considered within these plans. And so I'll talk a little bit about the philosophy, principles, and practice requirements, the funding that's available for planning, and the behavioral health agency, the staff requirements and tools that they have. So you understand, they're doing the heavy lifting, but you need to understand what they're doing and make sure they're reporting to you so you are comfortable that it's happening and you can interact with them to help them get into areas that they may not have access to in order to more meaningfully engage with different stakeholders through planning processes. And then the board and commission requirements in terms of membership, which I've already reviewed with you, but also duties. And then we also have toolkits that are available to different groups, including boards and commissions, but just to help the community understand how to engage in the planning process and be a part of it to inform the system, whether that means the next Behavioral Health Services Act integrated plan is changed by that input, or maybe a few years down the road, that plan will be changed, or those considerations might even come to the attention of your board and commission, and you might make recommendations for those. So philosophy, principles, and practice requirements. Recovery vision is required within these principles, and that we would be person-centered, number one. Secondly, promote consumer-operated services. Third, reflect cultural, ethnic, and racial diversity and address inequities. And then fourth, to plan for each consumer's individual needs. The funding that's available is up to 5% of total Behavioral Health Services Act annual revenue. So quite a bit of funding can be provided. That means the staff could hire people onto staff that are really just focused on doing planning activities, especially in small or medium to large counties. The smaller counties, they usually are a little bit less in terms of how robust they can do, just because they don't have as much staff, but they can still allocate up to 5% if they want. So that's even substantial for a small county. And this should pay for the costs of consumers, family members, and other stakeholders to participate in the planning process. So that could even mean that the county might contract with some of the community-based organizations to help them with community planning. just to help be that conduit to the community, to help engage and do some outreach and get the information that they need and the connections that they need into those communities to help them build the next plan.
What the BHS annual funding is somewhat a question. If you think it's only the old MHSA rolled over funds, the 30 million we get in Sonoma County, 5% of that is a figure. But if you think the plan, the integrated plan is supposed to mean that BHSA planning is opioid realignment, Measure O,
Yeah, let
there's,
me stop you there.
okay, so what is
Yeah,
the
so
annual funding?
And of the Behavioral Health Services Act
Only.
funding, yeah, that comes from the state.
Okay.
And that is substantive though in
Oh,
itself.
sure.
That's usually about 30% maybe, or 25%, 25 to 30% of the total behavioral health budget.
Okay. Thank
Uh,
you.
Sure. The local agency has specific cultural competence requirements. This term cultural competence has been, it's in question right now. There was a recent executive order on the federal level saying that we should not use federal funding for cultural competence, but there are federal requirements for cultural competence. So I just wanted to call your attention to that. But so this is what we still have in place in terms of the counties have requirements to do cultural competence plans, which means they need to commit to assessing service needs, creating strategies and efforts to reduce disparities, all these different activities that would decrease the disparities in terms of certain races, cultures, ethnicities, and language capacity is even part of that. So these are still federal requirements, even though we're not supposed to use the term cultural competence. The local agency staff requirements includes the behavioral health director's requirement. I mentioned this earlier. They are required, and I put this in highlighted text. They are required to recommend to the governing body, usually that's the Board of Supervisors, after consultation with the advisory board. So they should be consulting with you before they recommend anything to the Board of Supervisors. Okay, so just want to make sure that you're aware that this is in code. It's on the agreements that they sign, that they should be in consultation with you. Meaningful stakeholder involvement. Now we put meaningful in italics just to emphasize the word meaningful. If you're going to have 29 stakeholder categories that are required by law now to be consulted through the planning process when a Behavioral Health Services Act integrated plan is being worked on, for the planning, the stakeholder involvement will not be meaningful if that means you're just having big meetings and just inviting all these different groups. That's not going to be meaningful for a lot of those groups. So we want you to just be aware of this requirement for staff. They have to be engaging in a meaningful way throughout the planning process with these 29 different stakeholder groups. And part of your job, remember, I just switched over from that other PowerPoint. You're supposed to be ensuring that there are procedures in place that allow the stakeholders to be part of these planning processes. So those procedures are things that you need to be able to review. You want to get some presentations from staff. You want to know from them, what tools are you using? What kind of schedule do you have? Are there any meetings that are open to the public that our board members could be attending, just so we can be present and listen to the public at those? You know, that sort of thing that they could be presenting or providing updates on. And then this next slide, and this slide after, provides some tools. So we want people to get away from thinking one big meeting. You know, we don't, sure, you can have some big meetings. That's fine for community planning, and you can get some input, and that works sometimes. But there are many, many ways to have community planning. And so I'll go briefly through this. Education and engagement. These are all in the policy manual from Department of Healthcare Services, so all suggested by them. Listening sessions, and Cal BHBC, our organization, has a toolkit that we recommend for meaningful listening sessions. Conference calls, client advisory meetings, consumer and family group meetings, town hall meetings, video conferences, media announcements, targeted outreach, public comment, and that can include public comment at your meetings, public hearings, stakeholder work groups and committees. A lot of the counties have cultural committees, and they also have quality improvement committees. Some of them have other committees. They may have committees, you know, related to children and youth services. Sometimes that's a standing committee of your own board or commission, but sometimes it's just run by the county. Focus groups, surveys, key informant interviews, or engaging with subject matter experts, training, education, and outreach, and then other strategies. So a lot of different ways to engage with different stakeholders. And, you know, before I move on, I just want to say, you know, part of the issue with behavioral health is that we want to get to people that have been traditionally unserved or underserved. And if you're going to be, you know, considering their voice in your planning efforts, it's important to reach outside of your normal circles, or the staff needs to reach outside of their normal circles and find tools that would engage them in those conversations.
Stacy Dalgleish. You know, I've been involved in most of these tools, but one that I haven't, and I would like for you to discuss the Brown Act issues related to this, are conference calls. What are you thinking of when you say conference calls here, and what would be the requirements for me if I were to use that?
Right. Yeah. This list was compiled by DHCS. I think, you know, a conference call, sometimes people think of even a Zoom call. It could be a conference call.
Okay.
Some of the counties still have conference phones where it's just voice, it's just audio.
Okay, thank you.
Sure.
Also, when I mentioned when it had the media announcement in San Diego County, a lot of times we would think of just TV advertisement, social media, but our county did a survey and used billboards, like billboards around the city, big, huge ones, and they found it more effective where it was accessible to many people. Homeless, and it just worked out really good, but we didn't think about it as a behavioral health board. And through different conversations and understanding the cost effectiveness, it was used last year, and it turned out to be a very positive and reached out to a lot of people. That was a good idea that didn't pop into our heads at the beginning. So I wanted to share that.
All right, I'll stop there for the community planning requirements. And I'm gonna go back to the other presentation that we had.
If I can just clarify, because that goes under the heading of media announcements, like using billboards. It's part of that whole umbrella of media announcements.
I just wanted to build, Christine Hatia from Napa County. I just wanted to build on what Bill was saying about billboards. It's not being used for the planning process in Napa, but our Suicide Prevention Council has been doing transit advertising. So they have ads on the buses as they go, talking about the suicide prevention and the 988 number and all of that stuff. And one thing I like about that is that the buses go to places where people don't necessarily have cars. So they actually reach some of the other, some of the people that are not normally reached by the system. So that's just another idea for how we can do media advertising for, if there are public meetings about BHSA or something.